Exciting news for many skin cancer patients. There's a new combination drug therapy that is putting some patients with advanced stage melanoma into remission. And it got its start in a lab right here. We're taking action for your health tonight with a closer look at one of the biggest advancements in melanoma treatment in the past 30 years. Patrick Wilkins is like many Floridians. He enjoyed the water and all the sun and fun that went with it until his legs started swelling and he had to go for a CAT scan.
They found that it was a tumor. It was when they got it out, actually, it was the size of an orange.
In your lung?
In my lung.
That tumor turned out to be stage 4 melanoma that had metastasized.
It was in his bones, it was in his hip, it was in his lungs. 10 years ago, even 5 years ago, metastatic melanoma at stage 4 was pretty much a death sentence.
But a research team at Moffitt, led by Kieran Smalley, came up with the idea of combining 2 drugs into one therapy to basically shut off the pathway for the type of melanoma Patrick had. And it worked in clinical trials for many patients.
It wasn't just 10%, it wasn't 20%, it was like 70% of the patients were having major league responses.
Including Patrick.
And what causes the pain in cancer is the growth pushing against the nerve endings. I was on 3 doses of morphine. I started these 2 drugs on a Friday. I called my Dr. Weber on Saturday and told him it's working. My pain has stopped, and it had never come back since.
And it's been about 3 years now. Patrick says recent scans show he is 98% in remission. Due to the great trial results, the FDA fast-tracked approval of this combination therapy.
Oh, it was incredibly exciting, actually. As for us, we can spend years carrying out experiments and things hardly ever end up in the clinic.
But this therapy is being used in the clinical setting. Patrick had another scan today at Moffitt, but he's still on that combination therapy. And the idea here is eventually cancers like this can be a controlled chronic disease like HIV or diabetes. We'll keep you posted. If you'd like to learn more about the research and the drugs, head over to my Facebook page, look for Linda Hurtado, WFTS, and like the page.